Welcome to our May extended LabCoP session. This is one of the sessions that we dedicate to topics that are of interest to our community. As you already know, we already have our flagship viral load sessions. We also have the COVID-19 series, but we also have this new series that comes in that touches all lab system strengthening elements that helps our systems. Just to remind you, this will be a 1 hour long session that will start with some presentations followed by a Q&A. And I also want to mention that in line with our key goals at the LabCoP, today's session is one of those interesting ones in which we are saying in order for us as the LabCoP to facilitate the improvement of laboratory system functions and accelerate the scale up of diagnostic tests for endemic diseases, locally prevalent health challenges, and as you have already also seen, global challenges that come through with us for improved outcomes. We tend to use our theory of action in which we identify gaps through assessment using standard tools. We share these best practices and develop actionable work plans. And we like the term actionable work plans because we think actionable work plans are those, in most cases, that are tied to funding. And today's session, the Global Fund will be presenting the Global Fund COVID-19 funding mechanism, which is an opportunity for countries to request funds to strengthen their systems in response to the COVID-19, with some pillars dedicated to the laboratory systems. In identifying gaps at ASLM and world over, we are also proud to report that this is also part of the Global Fund process, and we have also seen an adoption of one of those tools that has been in use, namely the GHSA LabNet scorecard, as a way to link evidence to targeted interventions, as you will also hear from the presentations that will come. This is a tool that was developed in the aftermath of the Ebola crisis. And coincidentally, we also have a crisis right now for COVID-19. It is fully complementary to the WHO JEE tools and provide high-level granularity to evaluate laboratory systems and networks across diseases. And most importantly, under the coordination of the Ministry of Health at high level and inclusive of many stakeholders following a One Health approach. In today's presentation, we are also going to, in addition to hearing about the mechanism, we're also going to hear about an innovative tool that we are talking about here. I think Fatim will give us more and team around that allows members of the national TWGs to work at an operational level to identify these targeted interventions and ultimately submit sound funding requests. So what does this really mean to us at a national level? It means, as I can show on the screen right now, for countries that are already in the LabCoP, that have already used some of these tools, such as the LabNet, countries like Burkina Faso, DRC, Nigeria, Uganda, us from the ASLM team, we commit to provide assistance in this process before the deadline, of course, that will come through. And we envisage seeing these applications becoming more and more fluid, as you can see from the chart coming through, moving from the scorecard, the GEF application, and then the funding requests being submitted. I'd like to call upon colleagues from the Global Fund to come on board. But before they come, we want to run a poll in order to just gauge a sense of what is really happening in the country, what are the perspectives within the countries with regard to the mechanisms for application for Global Fund. On your screen right now, the poll will be launching. Please take a few minutes to respond. Colleagues, for responding. As you are finishing off, I would like to hand over to our colleagues from the Global Fund, namely Patrick, Ketevan, Fatim and Martin, who will take us through the presentations today, following which we shall have a Q&A. Thank you. Over to you, Patrick and Tim.
Before I hand over to my colleagues, I would just like to again thank ASLM and all the participants that joined. And please feel free to add your questions in the chat. And without saying much more, I'll hand over to my colleague Keta to start the presentation. Thank you, and over.
Thank you, and good morning, good day, good evening to everyone. Good to be here today. I will be taking you through, if we can have the slides, please. I will be taking you through the C19 the COVID-19 Response Mechanism overview. And this is the Global Fund launched. You may, I'm not seeing the slides yet, but yes, I think they're coming. Thank you. If we go to the next slide, I want to give you start with an overview of what it is that we're talking about. What is this Global Fund's COVID-19 Response Mechanism is? So we started in what we call the phase 1 of the mechanism in March of last year of 2020. And we launched the C19 response mechanism, which was providing additional funds to the countries, and at the same time also grant flexibilities using the regular core grant funds savings to respond to the urgent needs of COVID-19. So through C19 mechanism and grant flexibilities, we awarded 988 million to the eligible applicants last year, from March to December of last year. Alone from C19 we awarded 759 million to the countries. And again, this was additional funds that were made available to the grants. Building on the lessons learned from this phase 1, in March of this year of 2021, our Global Fund board approved the extension of the mechanism. And now we have the capacity of 3.7 billion US dollars, which was made available thanks to the generous contribution from the US government of 3.5 billion, and then additional contribution from Germany of 140 million euros. C19 supports 3 areas, and this is the same as with phase 1. The areas are COVID-19 response. So this is directly linked to, for example, COVID-19 diagnostics, PPE. The second area is COVID-19 related adaptation of programs to fight HIV, TB, and malaria. This is very critical in light of the impact that COVID-19 has had on the programs that we support in this 3 diseases. And the last very important area is the strengthening health and community systems. If we go to the next slide, there are a bit more details on how the award, as I mentioned, 759 million in 2020 was awarded through C19 and if we look at the 3 areas, the split was third of the funds, or 32%, went to the mitigating COVID impact on the HIV, TB, malaria. Quite a significant portion, almost 60%, was channeled through the COVID-19 direct response interventions, and then 10% went through urgent improvements in health and community systems. So unfortunately, we didn't see an uptake of community-led responses in phase 1, and we are really hopeful that in phase 2 we will see more of community-led interventions funded with C19 funding. If we go to the next slide, this is just to give you a sense of what we're talking about. So if we compare it to the previous phase, we are expanding quite significantly. So we now have a capacity of 5 times more of what we had in 2020, and responding to the requests from donors, from the board as well. We've really enhanced the way how we work through C19 the diligence and as well as transparency of how decisions are made have been really been taken to a higher level of, and expectations have been set. The bar has been set quite high for this next phase. If we go to the next slide, So I mentioned already, again, with special thanks to the United States government for announcing $3.5 billion to the Global Fund's COVID-19 response, and Germany's contribution of 140 million euros. This is what makes C19RM possible to support the countries that we serve. I would like to highlight one important consideration of why it was decided to extend the mechanism. Is one reason was the feedback that we've received from the countries that really appreciated the speed at which we were able to deploy the funds. And then also end of last year, our Inspector General independent office at the Global Fund did an audit of the mechanism. And actually what they found is quite significant and quite remarkable, is that even though the COVID-19 response mechanism was the last mechanism to be announced, it had the highest conversion rates in approving funds. And indeed, funds were approved within 10 working days of starting the review process once the application was received. If we move to the next slide, please. So what it is that we are doing now with C19 and RM 2021? What have we learned? So what is new now is that every country received an allocation letter. Every country and multi-country, so any eligible applicant, received the allocation letter that indicated the base allocation amount that the applicant should more or less expect to receive, so which is equivalent to 15% of their HIV, TB, and malaria Global Fund's country allocation amount. In addition to that, the countries are also encouraged to submit above base allocation requests, which should be at least additional 15% of their country allocation amount. So what we're trying to do is that to encourage countries to really think of the needs and make this proposals really responsive to the needs on the ground and not to be restricted, so that we want to see ambitious requests. Now, it's important to highlight there's no guarantee that the countries will receive this above base allocation request. However, it's quite likely that at least some portion of the above base allocation will be awarded immediately, depending on the review of the requests. Now, what is really critical is that the fast track, we've launched this, I will speak about in more details at the next slide, but we have two possibilities for the applicants to apply: through the fast track funding requests, which are for the urgent needs of critical COVID-19 health products, and then through full funding requests, which are to be submitted through scheduled submission windows. In addition, what we've done in this phase is that we have really strengthened the guidance. So for example, CCM engagement, endorsement is a requirement, as well as the coordination with national COVID-19 response coordinating bodies. And the reason for that is that any response that will be funded through the Global Fund funding needs to be part of the overall response in a particular country. So we want to see this coordination really enhanced. To support the countries in preparing applications, we prepared the technical guidance, which we will speak to in the subsequent slides. We have provided also additional guidance, for example, on the community system strengthening. We are also strengthening our assurance and accountability and enhancing the oversight and transparency of both decision making, but also of reporting. Next one, please. So who is eligible? It's all current implementing countries that are receiving Global Fund funding, and this includes regional multi-country recipients. Next, please. So this is a really simple snapshot of what I described on the C19RM allocation amount. So as I mentioned, 15%, what we call the base allocation amount, which depending obviously on the quality of the submission, but every country more or less should expect to receive this 15%. And then additional 15, which comes as above base allocation. And how much each country will receive will depend on the what we call adjustment factors or some contextual considerations. For example, COVID-19 burden in a country. trajectory of the COVID-19 the pandemic, level of disruption to the HIV, TB, and malaria services, availability of other donor funding. So for example, if the country is not receiving any other donor support, that may be a reason to give them more of the above base allocation request. Utilization of previously awarded funds. If the funds are not utilized even of the previous C19 RM award, this may be a reason not to give country an additional significant increase through the above base allocation. So these are the considerations that will be made by the Global Funds Investment Committee at the time when awards are being made. So if we look at the fast track funding requests, so fast track, as I said, we are going to start receiving, we've already received 12 fast track applications, and the scope of the fast track is quite limited. It's focused on the PPE, diagnostics, therapeutics, and oxygen is a very important element that I want to highlight, as well as any interventions which are needed for the effective deployment of these commodities, and this will include technical assistance if needed. So any country can receive this fast track, apply for the fast track on the rolling basis, and as soon as they receive the allocation letter, as I mentioned, we've already awarded made awards in two of the fast track applications. We also discussed 3 fast track applications this morning, and notification letters will be going out shortly. Next slide, please. And this one really talks about, and so once the urgent needs have been covered with the fast track, the countries can take more time to develop more longer term, more complex interventions, and then they can submit applications through the what we call full funding requests. And for that, countries have 4 submission windows. If we can go to the next slide, I think we have dates available here. We have the first submission window, which is upcoming this Friday, 14th of May. Then in 2 weeks' time, end of May, we have the second one. And then again, 2 windows in June. So by end of June, we will hopefully will have awarded all available funds. So C19RM, we have the funding request tracker, which is available on the Global Fund website. So anybody interested can go to the tracker and see which of the countries, multi-countries, is registered for which of the windows. So that's all transparent and publicly available. So that the idea is that once the countries have gone through these 4 windows, then we will know if there are any remaining unawarded funds, and then we will be reassigning these funds according to the unfunded quality interventions that we have on the register. So this is really a high-level snapshot of what happens, how the review is taking place. In addition, so decisions will be made internally by the Global Fund Investment Committee. However, in addition to the internal teams, we will also be tapping into the external partners, such as GAC and also CTAC partners, who are external people who have 3 working days to review all funding requests, both fast track and full funding requests, and they will be providing their independent assessment of the requests that will be taken into account when making decisions. Most of the requests will be determined by the investment committee. In some cases, we will have to go to the Global Fund board, and this is only for the requests that are either above 35 million or have some significant risks associated with the request. So the idea is that on average, if we go to the next slide, I think we have timelines, but yeah, before I'll just briefly mention the timelines. We're looking at a 7 to 10 day time of when we inform the countries of the fast track awards, and then we have about up to 20 days for informed countries of the full funding requests. So on the technical guidance and partner engagement, we've mentioned we've improved technical guidance and application materials. We are really encouraging partners to get engaged in country when developing the funding requests. And the best way to engage is through the country coordinating mechanisms, which are preparing the funding requests. So we expect that this engagement happens in countries when prioritizations are happening. However, as I mentioned, we also have regional and global coordination as well of the requests. So if there are any issues that need to be flagged, that can also happen on this global level. Next slide, please. Really on the, just a few words on the technical guidance. We have issued the C19RM technical information note, which provides very good guidance, technical guidance on eligible interventions, and this is based on the WHO guidance. And emphasis is really on community-led responses, and for that reason, we also have published standalone technical information note on community systems and responses to try to improve the community engagement. And in addition, we have HIV/TB and malaria information notes, which specifically describe some of those specific interventions that can be funded to support countries in responding to the COVID-19 pandemic for the 3 diseases. And of course, overarching WHO strategic preparedness and response plans for COVID-19 should be the guiding documents for any response in a particular country. Next one, please. So just a few key messages before I hand over to
Ketevan, to a kind request from the interpreter to kindly go a little bit slower. So,
okay. All right. I was trying to rush because I'm mindful that there is another presentation. Okay, I'll go slower. So the key messages in the allocation letter that we communicated to the countries is that every C19RM funding request must be consistent with WHO guidance. We expect countries to meaningfully engage with communities, with stakeholders, and have appropriate community rights and gender-related interventions included in the funding requests. They must align with the national COVID-19 response, and I already mentioned they must be fully endorsed by the CCM, as well as we need to see evidence of coordination with national COVID-19 response coordinating bodies. So another area that is very critical is how we will be looking at how exactly the C19RM funds are complementing domestic and other sources to ensure that there's no overlap of funding provided by different sources. And of course, highest priority interventions we expect to be those that provide the value for money. And very important point is that investments must lead to long-term outcomes and of course contribute to the future pandemic preparedness and partner engagement. So these are just a few points that, yes, and this is now Martin. Over to you, Martin.
Good afternoon, everyone. So as you all know and can imagine, we expect health products to be a large part of the response. Of course, not the only part, but those products to fight COVID, to control COVID, are essential moving forward. So there are about 250 products that are mapped to the WHO interventions that are needed to deliver on the various interventions. And information about all these sort of products that are eligible for procurement through the Global Fund are listed on our website. Within those, we've identified products that which we call optimal, and those that we call limited specialist use. We brought in this categorization to focus the eyes on those most essential products. They're the ones I call the no regrets products that every program needs. And amongst those in the diagnostic space, we're talking about the PCR tests, and we're talking about the antigen RDTs, and similar sorts of interventions in other product groups. Then the limited list products are those which are more specialist. We're talking here about the analyzers, the machines, gene sequencing, where there's a little bit more explanation needed and due diligence needed to ensure that's a rational investment. The Global Fund's pooled procurement mechanism is the preferred mechanism to acquire these products, and the product offering there has been matched to have all of those needed products that I mentioned before. And we're also closely engaged with the ACTA initiative, the global initiative about bringing new tools and tools to scale and speed as quickly as possible, so that we can scale new interventions as soon as they become available in the coming months, quarters, etc., etc. If we could move to the next slide. On our website, there is a document that gets to the product level, articulating which products are optimal, eligible for the fast track, where we have a very speedy review, as Ketevan was describing, and then the full funding requests. We also advise on the same matrix around the optimal way to procure these things. So there are some products where it only makes sense to procure at the local level. Things like some of the infection control products are in soap, sanitizer, alcohol, bleach. Those things really need to be sourced locally. But also there are, in the diagnostic space, some local contracting arrangements in place for some of the PCR testing, where again, it doesn't make sense to not use those. Then at the other end of the spectrum, there are some products classified as strategic products, where they're scarce on the global markets. In reality, for the countries that we're working with, we're fighting for volume with the high income countries, and where some greater visibility and greater pooling of demand is essential to secure those products. And in that bucket, we include at the moment the Cepheid tests, Cepheid PCR tests, and the antigen RDTs. And then in the middle, we have all the other products where we encourage the use of our pool procurement mechanism, but actually other mechanisms can be used, providing there is certain confirmation of procurement performance and a commitment to report frequently to the Global Fund. Move to the next slide. I think that just summarizes what I was saying about the procurement channels, that the preferred channel for the mainstream and strategic products is our pool procurement mechanism, and there are mechanisms to use other channels, providing we are sure that the procurement performance is good, especially with respect to speed and quality compliance, and a commitment for reporting on a monthly basis, so that we can see that product delivery doesn't mean impact, but if product's not delivered, there won't be impact on diagnostics, for instance. I think I'm handing now to Fatim. That's just a placeholder linking to our website where all this information can be found.
Thank you so much, Martin. So as my colleagues have been saying, so the C19 Response Mechanism 2021, the eligible investments are aligned with the WHO COVID-19 Strategic Preparedness and Response Pillar framework. And I'm just going to talk, these are the different pillars, and I will talk more about the Pillar 5, which is the laboratory and diagnostics. Next slide, please. So under the Pillar 5, the funding request should be based on national testing strategies that, as have been said, should be aligned with WHO guidance and should articulate challenges with lab systems. If available, data from lab assessments, for instance, using the LabNet Tool or JEE assessments that have been done, or assessments done using the WHO lab assessment tools program reviews. And basically these assessments have articulated gaps in lab systems in national lab strategic plans or national action plans should be considered and added interventions in the funding request. It is also important to leverage on past investments and already installed equipment to strengthen and expand laboratory and diagnostic capacity to respond to COVID, whilst also mitigating effects of COVID on HIV, TB, and malaria. Also, there's need to ensure integration of COVID-19 testing into existing tiered lab networks and systems. Procurement of diagnostic products and equipment should consider lab system strengthening and innovative approaches for improved service delivery. And funding requests can include support to specimen transportation networks, both nationally in country or regionally, if, for instance, samples have been transported to regional labs to support genomic sequencing. Also, the funding request can include support to strengthen quality management systems, laboratory information management systems, equipment management systems, as well as biosafety, biosecurity, including waste management. These all these systems strengthening interventions can be considered and included in funding requests. But as been said, these requests for these interventions can only be included in the full application and not in the fast track. Next slide. So here, if you look at the information note in Annex 2, we describe 4 different packages of support. And the packages for support to the COVID diagnostic strategies respond to the needs for tailored support based on each country's stage of the response and the lab system's readiness level, and from the early phase of implementation to a more mature phase of implementation of COVID diagnostic strategies. So countries can include in their funding request support for one or more of these packages. To include, as shown here, package 1, which focuses on introduction or scale up of antigen diagnostic testing, and package 2 includes support to scale up of molecular diagnostics, whilst package 4 includes activities that would support genomic surveillance. Finally, package 3, which is a package that cuts across all the aforementioned packages, but includes activities to support strengthening of integrated lab networks and systems to support diagnostic, as I've just mentioned. So there is also opportunity to support training. Could be training of healthcare workers, lab staff on different aspects, from antigen identity to molecular testing to bioinformatics. And there is also possibility to include TA support to strengthen lab system and scale up testing. And these could all be included in the funding request. There is also possibility, even though not noted here, to support COVID surveillance activities, including serosurveillance, strengthening HMIS or IDSR, also GLLP, Global Lab Leadership Programs, or field epidemiologic and training programs. And these are all considered actually under pillar 3. Next slide. I think that's it. Yeah. Hand it back to Keta.
Yes, thank you. So this is really briefly. I also was trying to respond to some of the questions in the chat. So we've mentioned that we have shared allocation letters with all eligible applicants. This information is available on the Global Fund website, and I just shared a link to the website where it's publicly available. Out of 129 eligible applicants, we have 119 have already registered for one of the 4 windows that I mentioned before. Out of the 119, 43 have indicated that they will be submitting fast track applications as well. And as I noted, 12 of them have already submitted their applications. So if we go to the next slide, it just gives you a real nice snapshot of the fast track projections. So as expected, we are going to see an increase of applications coming through now mid-May, next week as well, and then towards the end of May, we will start seeing more of the full funding requests than the fast tracks. If we go to the next slide, this gives you an overview of this 119 full funding requests registrations. We expect to have a very busy window 2, which is end of May, and then as well as June. If you look at the projections of this 119 full funding requests, it is an estimated total of 3.8 billion. US dollars, which also includes the previously awarded fast tracks. So this information is available on the Global Fund website. The link that I shared takes you to the page that has the Global Fund allocation amounts, the base allocation amounts, but it also includes this information about which country is registered for which of the 4 windows. So I think this is the end of the presentation.
Thank you very much, Keta. I'll take it from here. I appreciate being given the opportunity to share some of the work that we've been doing in the laboratory systems strengthening team. This is Patrick Royle from the lab team at Global Fund. And I'm pleased to share one of the tools that we've prepared, which does have, it does provide an avenue for countries in identifying the level of support which is needed under C19 RM. So a central consideration of our support to countries at Global Fund is ensuring that we provide support which is well tailored to country needs. Understanding the country needs relies on visibility over existing systems and resources available, and knowledge of the capabilities of the laboratory network of the countries that we serve. As many of our colleagues online from laboratory directorates are aware, countries regularly undertake various readiness and system capability assessments. These include the LabNet Tool, the Joint External Evaluations, WHO Afro Tool. These tools identify the limitations of a national laboratory infrastructure. However, the outputs of those assessments are usually under-leveraged due to insufficiently executable and due to limited downstream utility. The missing piece of the puzzle is usually, what do we do with the results of these assessments? The core functionalities and capabilities listed in existing tools and assessments don't provide a detailed step as to what's needed in order to drive the readiness of the system forward. The most robust tool available in order to assess a country's laboratory capabilities is ASLM's LabNet Tool. LabNet includes 9 building blocks, which are the core capabilities shown on the screen, and they guide stepwise implementation of laboratory capabilities, including multiple subtopics, a few of which you can see within each of those boxes. We adapted the LabNet tool and other existing assessments to generate similar questions included in ASLM's LabNet, covering a wide range of topics. These questions will be familiar to some of you who have participated in other assessments like LabNet or Joint External Evaluations. For instance, in Coverage and Availability section, the tool asks you to respond to the question of whether a national sample referral system and transportation system is in place. Responses range from score 1 to 5. Of course, you'll be familiar with that if having undertaken some of these assessments before, as it is a similar structure to other tools, where 1 is an absence or a foundational level of capability in the system, and 5 is the attainment of international standards. By selecting level 1 in this example, where no sample transportation network is available, the tool we developed then produces a list of possible interventions and activities which may be undertaken to achieve the next level of capability. The interventions are available at every level of response selected from 1 to 5. In addition, the interventions are tailored to that level, ensuring that they respond directly to the level of capability which is reported. When combined, the listed interventions provide the practical operational steps which can then be taken to improve and increase capabilities of the laboratory system. The tool also allows respondents to suggest other interventions and activities to those that are available, which then may be built into the tool into the future. By providing a list of interventions for selection, respondents may identify the clear, specific, and operational steps which may be taken to advance the system, essentially generating a roadmap for development. This list of steps can be presented to funders and partners to request technical assistance, not solely for the purposes of C19 RM. For instance, in this example, the first intervention on this list, to develop and implement a plan for sample transportation network by analyzing the mapping of laboratories, may be funded by Global Fund under a strategic initiative. The second intervention, cost analysis of outsourcing of a sample referral system, may be funded by a partner organization, and the third intervention may be built into the national laboratory financing structure. Completion of each of these operational steps advances the system over time and allows a clear coordination between the country, partners, and funders on the priorities. Use of the tool generates a clear picture of the activities which may be prioritized to serve the country. In this example, a country may have used the LSS tool in 2021 and chooses to make investments in structure and organization, laboratory information systems, and biosafety and biosecurity. In 2023, we see the impact of those investments, with the scores increasing, for instance, structure and organization from a level 1 to a level 2 via support from a Global Fund grant for the National Reference Laboratory, in lab information systems via a new LIS adopted with support from a partner from level 2 to level 3, and then biosafety and biosecurity, where we see biosafety cabinets purchased by the Ministry of Health with Global Fund support, and then future work in 2023 identified. This also provides us an advanced warning system. Quality management, as you can see on screen, is reported to be at a level 1 in 2021 and again at a level 1 in 2023. This indicates that quality management is an area which is seen as underinvested and could be prioritized. To finish off, the LSS tool is a user-friendly Excel format tool. It's modular, so if a country is particularly interested in one of the 9 core capabilities, they may choose to use only one or all 9 modules. And finally, the tool allows respondents to use the results from existing assessments undertaken to respond to the questions. A list of interventions and activities is immediately available upon completion of the tool, allowing full visibility over potential areas of investment. Again, these results may be used by some countries and have been used by countries to identify needs for TA, which can be included in Global Fund C19 RM funding requests. We'll make the tool available to you all shortly after the meeting. I would be happy to support lab directorates interested in using the tool with a virtual session. Finally, I'd like to thank ASLM for their kind collaboration and for lending their expertise and input into this tool. We're very privileged to have such a collaborative partner to work with on this. I'll turn back over to our moderator for the Q&A session.
Thank you very much, Patrick. Thank you, Ketevan. Thank you, Martin. And thank you again, Fatim, for the wonderful presentations. Quite a lot of information shared, and a lot of questions also coming through into the chat. We will try to address as many of them as possible. But I also want to acknowledge all our presenters that have already started responding to some of these questions that are coming through. Maybe let me pick the first question that just came through here, which is asking around whether Global Fund is also able to, I'm deliberately picking this one because it just came through, the other ones have been responded to, is able to support some regional partners, I think, beyond countries. Any of you can take that.
I can take that. I'm not sure if Keta is still online, but yes, we do fund regional grants, and there are already regional partners that do that are PRs. So, and it is possible for the regional PRs to submit grant application. Over.
Fatim, maybe I'll just add that it has to be the existing regional grant or the multi-country grant, so the one that is currently receiving the Global Fund funding. And again, by now there shouldn't be any confusion on that, because all eligible applicants would have received the allocation letters by now.
Okay, thank you very much. Quite also a lot of questions that are coming through. I think one of the most important ones is timelines. This is a very tight timeline. So I'm going to deliberately just ask maybe Ketevan to just reiterate what are the timelines are we talking about for those that are just joining.
So as indicated, the fast track applications can come in anytime. There's no, we've already, as I said, we've received quite a few applications. For the full funding requests, we have 4 submission windows. The first, thank you. So it's right here on the slide. The first window is 14th of May, and then every 2 weeks until the end of June, which is the last submission window. Over.
Thank you. Then moving on, I think just tying to the submission windows, how are these allocated? Do countries choose themselves, or they are allocated by you? Again, I think there was a response in the chat, but for the benefit of those that missed it, quickly respond.
So when the applications come in, then they go through a very rigorous internal review by different teams at the Global Fund. At the same time, there is also review by our external partners. Then all this outcomes of the review are consolidated, and the final decisions on the awards are made by the Global Fund's investment committee, which is composed of senior managers, our executive management team at the Global Fund. So I responded to one of the questions whether it's possible that some of the parts of the application are not approved. Yes, indeed, that is possible. It will all depend on the review outcomes. So there may be a situation where only parts of the request are awarded, and other parts are not awarded. Okay,
thank you very much. Moving on, I think this is directed to Martin. It's coming from Owen F, who says, how can products that have not yet gained WHO, EUL, or any other SRA approval, but expected to be approved in the timing of procurement, can they be included in these proposals?
So thank you. And Owen later confirmed he was talking about self-testing for antigen RDTs. So 2 elements. First of all, we can only finance things that are meeting our QA policy, including the approved use. So the thing that he's talking about is an approved use of an antigen RDT, which is not there yet in terms of the eligibility for our QA policy. So we can finance antigen RDTs, but we wouldn't finance them yet for self-use. It has to be within the WHO recommendations and the regulators' approved use.
Okay. All right. Thank you very much. And this one is, the next question is coming from Heidi. Perhaps maybe Martin can also take it. For limited use products, for example, sequencing, is there a guidance on the justification needed to support due diligence?
Ask Fatim to answer that one as our lab specialist.
Thank you. Fatim.
So, of course, for sequencing request or request for genomic surveillance, we do look at several criteria. So, of course, the country will need to show that it has existing capacity and there's need to expand the capacity. So we will request for additional information, and we're also working with partners in the region. We work with AU-CDC, and based on the regional networks that have been established, we do consider those as well. Of course, in the past, Global Fund has funded several countries to establish sequencing capacity. Maybe next generation sequencing capacity might not be available in some of these countries, but we will look into existing capacity. But we do encourage regional collaboration, use of already existing regional networks, and we will try to discourage each and every country establishing sequencing facilities that are not sustainable. So basically, sustainability is something that we will also consider during review of the applications. I hope I answered it. but I could discuss with Heidi further. But basically, sustainability, existing capacity, and a country capacity, as well as regional capacity and chance to collaborate. And we really do also encourage in countries that there should be strong collaboration with in-country between research labs that are already have sequencing capacity and are supporting genomic surveillance together with national public health facilities as well. And we also do encourage if need for transport of specimens, these could be included in the funding request. Support for training for bioinformatics, these could be included in the funding request. We also do encourage that memorandum of understanding between countries be something that is swiftly developed, and as well as sharing of genomic data in the global databases. Over.
Thank you once again, Fatim. There is another question that came through, just not in the chat, but via mail. Just trying to make sure that I get the right one. And it had to do with where information on costing could be found. It came from Caroline Charlie, who says they are looking for cost information for equipment as they work on the C19 RM requests. Can either WHO or Global Fund support with costing information for, they mentioned 2 products here. Maybe I may not mention them, but do you provide information for products in terms of cost, or do you have a list where they can make reference to this cost?
Martin can take that.
So that was a question about the cost of products.
Can either WHO or Global Fund support with costing information, for example, QIAGEN, Roche, Auton?
Yeah, so I think the slide you have on the screen at the moment points to the second box where we are publishing what we're calling reference pricing. So there, for a lot of items, you will find, including the PCR and antigen RDTs, you will see pricing information. There's also information around what are the typical manufacturing and logistic lead times as well.
All right. Thank you. Questions keep coming through. I know we are almost right at the end of the session, but maybe there is still time to take 1 or 2. There was one question that came, I think it was in French, and thanks Pascal for translating that. I think if I remember well, I can pull it out quickly here, but if I remember well, it was asking, do you include any other products such as for glycemic control, etc., any other products that are beyond COVID-19 in this application?
Fatim, do you want to take that one?
Sorry, what was the question? I was busy answering something else.
Do you include other reagents such as for blood sugar, full blood count, any other diagnostics?
Yeah. So I did answer that in the chat, I think, and those could be included in the full application. Of course, not in fast track, but they need to show that the reagents or equipment that they are requesting for is used for clinical management of COVID cases, and there should be justification included in the full funding request application. So not in fast track, but it could be considered in the full funding request with justification.
Thank you very much, Fatim, for that. I just want to give each of the presenters about 30 seconds to just make some of their last remarks. Let me start with Ketevan.
Thank you. No, thank you very much. I hope the presentations were and discussions were useful. Thank you for participation.
Thank you. Martin?
Just to say, there's a lot of information on our website around accessing the funding, but also about the products and interventions. So a lot of homework for those who'd like to know more.
Thank you, Martin. Fatim.
Again, I would like to thank everyone that logged into the webinar, and also to thank ASLM for providing this medium for us to present the COVID-19 response mechanism. And I do hope after today, if you have not, you will reach out and be part of the application process and ensure sufficient support to strengthen lab systems, not just for COVID, HIV, TB, malaria, but also in preparation for the next pandemic. Over, and thank you everyone for your attention.
Thank you, Ian Patrick.
Great. I just reiterate my thanks to everyone, and final thanks to the interpreters who were able to make this more accessible for everyone online. So thanks very much, everybody.
Thank you. And as Martin has mentioned, that a lot of questions came around products, and also a lot of questions came around the tool. I see quite a lot of interesting and appreciating comments that indeed this is the way to go. As you mentioned, this tool will be sort of looking at what are the key gaps, as Fatim has mentioned, and then we are hoping that we are using these evidence-based gaps to inform our GF applications, and hopefully the funding requests that come with those approvals and those evidence-based gaps. And with the LabCoP, we continue to pledge our support to teams that need to use this effectively, and in collaboration with our colleagues at the Global Fund. We are at your disposal. There are quite a number of countries that have already used some of these tools and may also need to go back there and see what is coming up. And again, this platform is one that we always come here and share best practices. Hopefully, some of those best practices that we have shared are being included in some of these applications, for they are already proven to work. And hopefully we are not, as they say, rewinding the wheel. Talking about best practices, this is a good leeway into our next session. This is coming tomorrow. We are going to be talking about the application of digital tools to manage the COVID-19 pandemic. So please join in your numbers, and hopefully this could be some of the things that you may be able to also adopt, and hopefully our colleagues at Global Fund can be able to find these very sound and also fund them. Without saying many other words coming through from here, from ASLM and from our colleagues, want to appreciate the presenters for coming through, and most importantly, also as usual, our interpreters for making sure that we cast the net as wide as possible. Till we meet again, thank you and goodbye.